My non-dominant index finger here is at the subzygomatic line, and I'm basically on the transverse facial artery. So that was actually my non-dominant index finger here is at the subzygomatic line, and I'm basically on the transverse facial artery. So I know that if I inject above there, which is around 1 centimetre, this would correspond to the central part of the zygomatic arch, but I'm also going to be away from that critical vascular structure. So here, protection, always injecting away at a 45-degree orientation. I'm on the bone very, very quickly. Big aspiration here, and then I inject nice and freely. Slow injection, and around 0.1 cc, but really until I start to see a little bit of tissue elevation. You can start to see that Volift is already conforming to the tissue really nicely. So that was actually 0.15 cc. Now, when I mold the tissue, which is again very, very important, I'm always molding in the orientation of the desired lift. So lifting the tissue and just very gently integrating the product into the tissue. In terms of integration time, you've got about 15 minutes with Vycross to get it into the right position, and also to have the skin repositioning done before it's set. You're not going to have full tissue integration by 15 minutes. That will take anywhere up to 2 weeks. But what I'm saying is the patient, when they go home, you don't need to tell them to sleep on their back for 2 weeks anymore. Okay, now the second point. This is the intersection between the lateral brow as it meets the upper alar tragus line. This is the point of beautification. So if I calculate that, it's corresponding to around here. She has got a very tiny amount of, not festoon, but there's a little bit of over projection here. So we're going to go slightly below that area. So I'm just demarcating that maxillary zygomatic fusion and the inferior border, 45 degrees, and I'm going to go into the tissue. Again, I'm on the bone, aspiration, and then I inject. And again, this is going to be around that 0.1 to 0.15 cc. So, and again, we take this small amount of injection and we just mold in a superior lateral direction just to generate lift. Remember, I'm repositioning the skin. I want the skin to grab onto the tissue below it in a new location, so in a new superior lateral location. How I decide where to inject here is I'm going to feel. Tell me when it's right. Is it here? Okay, so we just do a small amount in the SOOF now, and that's going to be in this location as we just identified, just right here. So the needle now needs to go a little bit more steeper because I need to get to the target, and I don't want to inject superficially, yet I don't want to be on the bone, so it's kind of a rock and a hard place. So always up towards the medial canthus so you don't actually have an issue with the foramen. So not on the bone, aspiration. This is a very small quantity, so around 0.05 cc maximum. It still raises a small little bump, yeah, because there's not a lot of flesh here. I'll take the bump now, and this is really critical. I'm going to mold it upwards there towards the lid cheek junction, and only Volift will do this. You try this with Voluma and it's going to stay much more static. It's not going to have legs like this. Now, when I'm talking about safety here, I tend to recommend always injecting within 5 millimeters from the lateral part of the alar, and always in a medial direction, and then we're going to go deep. We're going to go to the bone. Big aspiration because we don't want any issues here. Oral corner, so this is easy peasy. You can probably do this with your eyes closed. So in the skin, forward in the white vermilion, just coming back, leaving a small amount here at the actual commissure itself, and then a tiniest little mold and a massage, so give it a tiny flick upwards. You can give some vertical support by changing the orientation of the needle, so coming from the inferior part and then working upwards. And this again is very superficial. So now we're going to go down to pre-gel sulcus. It's going to be a little bit deeper than before. So here we are, on the bone, aspiration with voluma. I'm going to do a little bit more here because I'm going to take this voluma and I'm just going to mold it anteriorly so we get a much better and sharp union between the jowl and the chin. See, I'm molding forwards here, never backwards, because I don't want it to be pushed back into the jowl fat. And I literally look down the jaw and line it up with the syringe to see how straight I can make it. So there's a slight little concavity left. And in that case, what I do is I'll actually inject lower down at the inferior aspect of the mandible. And again, risk is there, so always aspirating and then leaving the product behind here. You can see now it's correcting when I'm doing this. This mold is slightly different because it's at the inferior aspect of the mandible. I'm now conforming it to the angle, to the mandibular border. So pinch the angle of the mandible like this. I've got it between index finger and thumb. But the reason why I'm doing that is because my location for depot is going to be here at about 1 centimeter superior medial to the angle. My depth control is really important. So I pinch the skin. I'm going to enter, and I'm going to flatten off, because now I'm subcutaneous. Aspiration because of the vascular issues here. Leave my little bump. It's going to be about 0.1 cc, just until I start to see it rise. Now take my little bump here. You probably can't see it. Yeah, you can see it. And now I take the bump of voluma, and now I'm going to stick the skin against the ramus of the mandible. I'm going to hold this for about 10 seconds because I really want to feel the bump disappear behind my finger. And this is the adhesive effect, or the union-like effect of the skin onto the SMAS, and it's this that generates the lift of the jawline and reduces lower cheek rhytids on animation. Now let's just take a look at what this does to the jawline. Here you look, she's much more steeper. Give me a smile. And relax, kiss, relax, okay. Just remember the connectivity of the crow's feet extension and the lower cheek rhytids. Smile, relax, okay. Now we turn this way. Smile. Oh my God. So it's literally like Botox, meso-Botox of the entire skin of the mid and lower third. Smile again. Yes, it's quite unbelievable what can happen, and this is the integratory qualities of Volift. Now we'll get even better because we're going to lift here, okay? So we're going to give her a lower facelift using Volift in the cannula. First is, can I influence the oral commissure from here? No, not really. Is it here? Is it here? More. Is it here? Not so much. So it's here, it's in this plane. So of course, the insertion point is going to be a little bit more anterior. So what I'm going to do is I'm going to break those little cutaneous attachments to the SMAS just by very gently gliding the cannula over the top, and it's just a blunt subcision really. If you get stuck here against a little retaining ligament or a tiny bit of fascia, just do an anterior grade injection and you'll see you can advance a little bit easier. So now I'm just below the oral commissure here. So I'm just going to bridge through the mandibular retaining ligament there. I'll just do one more pass in these 3 planes. So I do superior, like this, and backwards. And then I do to the commissure. Always lower, of course, not above. And then I'll do one just aiming downwards, just trying to get to the mandibular retaining ligament. Just like this. So if I can't bring the cannula through, I actually bring the ligament to me, yeah? So, and that's me done. Good. So in terms of moulding, this is actually quite important because you don't want to mould it forward. You want to mould always in the direction of the desired lift like this, okay? So mould in this plane so that you get this, this movement and the uniformity of the product in this plane, so it really facilitates your lift. Smile, relax. Smile, relax. Smile, relax. Look at crow's feet. Smile, relax. Smile, relax. Kiss, relax. Kiss, relax. Okay.